Uh, Hello, doctors. How are you? We have 17 doctors. So we will start. So today we are discussing ethics. I'm planning to start in from mandatory notification. Okay, 1 minute. So you can type in the Google mandatory notification AFRA, then you can find the document. I think I have uploaded that document as well, the highlighted one that I have used. So let's little bit discuss about the mandatory notification. Okay, this one. Yeah, this is the guideline. Okay. Yeah. You can just Google it and find it. I think I have uploaded this one in my Drive link. In the file section, you can find it. Okay. Yeah, you can find it mandatory notification AFRA. Then you can go to this website and you can. Yeah, this is the PDF. Then you can download it. Okay. Okay, so let's discuss about mandatory notification. Yeah. So, what is the mandatory notification? Who can tell me? Mandatory notification is a legal obligation under national law to notify AFRA when registered health practitioners' health conduct or performance pose a risk to the public, right? Risk to the patients. So it is done to protect patient's safety, not to punish the practitioners, right? In like when we discuss in the ethics, we should know it's always patient safety comes first, right? So that's why we have to report this scenario, because why we need to think about the patient's safety first. Okay, so then like when we discussing about the mandatory notification, you should know about these three criteria: the trained practitioners and non-trained practitioners, so employers of practitioners. So like if you don't know what does mean these three, you can't understand this guideline, okay? Because they have something with for the non-trained practitioners, trained practitioners, something like that, okay? That's what I have made this note to identify. And we will discuss about voluntary notification as well later. So, first of all, you have to identify who you are. There are three different roles in mandatory notification. Those are trained practitioners, non-trained practitioners, and employer, right? Minute. So, who is trained practitioner? Trained practitioner mean if you are providing health care to another doctor as your patient, this is a doctor-patient relationship. Those are the trained practitioners. Example, a GP treating another doctor for depression, a psychiatrist treating doctor for substance dependence. These are the good example. Patient also a doctor, right? Patient also a doctor, and this is this is under doctor-patient relationship. And in this case, you learn about the problem of this doctor because you are treating them, right? That's how these trained practitioners get to know about these like drug abuse or other disabilities, right? Then when does a trained practitioner notify? Only if the doctor continues to practice and their impairment places the public at substantial risk of harm. Why? The law warned to doctors to seek help. Safety, confidentiality is strongly protected. And in that case, as example, you are treating a patient with, you are treating another doctor, and he's your patient with severe dementia. Okay, so like if the patient is taking medications, and but he also doing the practice, doing the clinical work despite of your advice, like not practicing, or you have to wait some little bit period to like get get a good prognosis like that. uh, the patient is not this doctor who has a dementia not accepting this doctor's advice and is practicing, then in that case you can report Afra as his treating practitioner, right? Yeah. Then who are non-treating practitioners, you should know who are non-treating practitioners. You are a non-treating practitioner if you are a registered doctor and you are not treating the doctor as a patient. Okay, you are a registered doctor, you treat other patients, but you are not treating a doctor as a patient. Okay, you become aware that issue through the work or observation. There is no doctor patient relationship here. Okay, so please remember, then it will easy to understand this concept. And one more thing, I will give an example. You smell alcohol, you smell alcohol and you notice the some slurred speech of your colleague doctor after lunch break. Then and you have you are suggesting this patient, this doctor, your colleague is intoxicated. In that case, you are a non-treating practitioner, right? You are not treating that doctor, right? That doctor is your colleague, right? So in that case, you can report it as a non-treating practitioner. Okay, here example: consultant supervising registrar, registrar supervising an intern, colleague on the same ward, medical administrator or director, clinical supervisors, any doctor observing unsafe practice at work. Here, you learn about this impairment or these mandate notification indications while doing the work with them. Okay, not with treaty. Okay, yeah. When the non-treating practitioner notify with the impairment, risk of harm to the public, like that. Okay. Then who is the employer? Employer is hospital, clinic, health service, or any organization that employs or contracts of the practitioner. The employer may be hospital executive, practical owner, medical service, like that. The employer may act through the medical managers and has independent legal duty to notify. Okay, if they're a higher position in the hospital, like hospital owner, they if they notice something trigger some activity that can trigger manager notification. In that case, this employer can notify the uh, AFRA. Okay. Here, what does employer notify? The employer reasonable believes that a practitioner practices impaired and places of public at substantial risk. The same thing. Okay. Uh, yeah. Then, what are the four main criteria of mandatory notification? So, what are those? What are those? Impairment, intoxication while practicing, significant departure from the accepted professional standard, and sexual misconduct. So you should know these. All four these are mandatory notification to AFRA, right? These are very high yield. Okay, that's why I asked to like concentrate. And if you have any doubt or anything, please ask after the session. Okay, otherwise, it will be it will be like not good for the flow. Doctor, can you ask it later? Okay. So you have to follow this one because first of all you should know who are you, right? Then you should know what are the indications for mandatory notification. You should know these four criteria. These are very high. Then you should know, but what is a reasonable belief? You should know what is the reasonable belief. So what is the reasonable belief? Who can tell me? Answer. Okay, you can type in the chat. What is a reasonable belief? What is a reasonable belief, doctors? You have to answer me, okay? Mm-hmm. Mm-hmm. Okay, so let's discuss. So, what is a reasonable belief? Mean you have a direct knowledge or reliable information, and a reasonable practitioner acting in a good faith would reach the same conclusion. It is not certainty, but it's more than a guess, right? So, how we should know it is as a reasonable belief or not? So, it can be a direct observation, right? You personally see or hear behavior that raise concern. Example, you see a colleague at work with slurred speech, smell of alcohol, and unsteady gait. You directly observe sexualized comment or inappropriate touching. You witness unsafe clinical practice that clearly depart from accepted standard. So, this is one criteria for reasonable belief. This is direct observation. Then, reliable first-hand report. You receive information from a credible source who directly observe or experience the conduct. The source must be trustworthy and information specific. If someone else has direct knowledge, encourage that person to notify if appropriate. Then professional judgment. You believe if shaped by your training, your experience, and your knowledge of professional standards. A reasonable belief is formed after objectively assessing all known factors, not emotional or assumption. So, what are not reasonable belief? These are not the reasonable belief. Rumors or gossip, workplace heresy, anonymous accusation with no detail, personal dislike or conflict, assumptions without evidence, social media speculation. So suspicious, like these are not enough to trigger the mandatory notification. I heard from this is a good example. Doctors, can you please mute your mic? Okay. These are the example. I heard from someone that might be drinking. This is not a reasonable belief. So, what is this is a good example? I personally saw him return from lunch smelling of alcohol, slurring speech, and attempting to see patient. This is a reasonable belief. So now you know who can report to AFRA, and you know what is a reasonable belief, right? Yeah. Then with the reasonable belief, you have to assess the risk, right? Because with this reasonable belief, you have to know the how much is harm to public or patients, right? You have to identify the risk, right? Here, forming a reasonable belief is step one. For impairment and departure from standard, you must also assess the is there a risk of harm to the public or it's a substantial risk. Yeah, yeah, the same thing. Then let's discuss about one by one. Give me 1 minute. Okay, so what is impairment? Who can tell me what is the impairment? Quickly, you have to answer.
And doctor, it may be a any disability, physical disability or mental capability of the doctor is not fulfilling the criteria.
Okay, yeah, good, correct. Yeah. So, what is the impairment? It's a physical or mental condition, including substance dependence as well. Okay. Mental condition that uh, detrimentally affect the ability to practice safety. Right. It can be a disease. Right. It can be a physical problem. It can be a, like tremors. Can be a severe dementia, severe depression, like that. Then when to notify? Trading practitioners only if impairment place that public at risk, the same here. Anyway, always we have to assess the risk, right? We should report these scenarios if there is a risk for the patients, right? Yeah, and we should have a reasonable belief. So these are from that PDF. Okay. here. These are the good example. Okay, first of all, I'll ask the questions. Okay, then you can answer 1 minute. Okay, you have to tell me if it is trigger mandatory notification or not. That's mandatory notification. 1 minute. Yeah. Okay, I'm telling the scenario. A practitioner patient has a small tremor which is being treated. They have restricted their practice to consultation and they no longer perform procedural work because the tremor would affect the procedure. No, not consultation. It caused it. So, is it a mandatory notification or not? Mm-hmm.
No, doctor.
Yes. No, why? A practitioner has a small tremor, but because of that tremor, he's currently not doing any procedure work, but he can consult the patient, right? It's not a mandatory notification. Then, okay, I'm asking another question. A practitioner with early dementia work as a sole practitioner, refuse supervision or practice restriction, and insist memory loss in the affecting care. What do you think, doctors? Patient is having early dementia and he's refusing another doctor's
Maybe.
practice, another doctor's advice or restrictions. He's working as his working in his solo practice as a solo practitioner. In that case, what we should do? Yeah, we
Mental
have to.
notification
Yeah,
given.
we have to inform him, right? Practitioner with early dementia work as a sole practitioner, refuse supervision or practice restriction, and insist memory loss is not affecting care. This places patients substantial risk to the harm, so mandatory notification required. The same example here, doctor. This I got this from there's AFRA guideline. Another one. Practitioner has a stable mental health condition, is engaged in treatment and practicing safely. So in that case also, we do not need to inform the AFRA. Do you remember the recall? I can't remember the month. The recall question, the patient with ADHD, not a doctor with ADHD, and he's well treated and he's doing his practice. He's currently practicing. So in that case, as I remember, they are asking what we should do next. So we should not notify AFRA, right? Because he's in a stable situation, right? He's currently taking medication, and if it is patient is stable, there's no risk of to the patient. So we should not notify, right? Okay, that's done. Then next one is intoxication while practicing. That what does mean? Practicing while under the influence of alcohol or drugs, right? Impairing reasonable care and skill. Private substance use does not count unless it affect the practice. Please remember, okay? Please remember this part because you remember in November we got one question. Do you remember we got one question? Patient, you are at a pub and you saw your colleague is having, can't remember, they were using some drugs or something. Then after, in that case, but you know, like after 2 hours, he's having morning shift in the morning. In that case, what we should do in that moment, we can't inform the after, right? The only thing we can hear, we can go and talk with that patient, not patient, that doctor, like you are now intoxicated, so you should not come to the practice after 2 hours, right? The only thing we can do, because he's outside the hospital, right? He's not during the practice. Like if the this is another scenario. If you saw this patient at the pub and you know he's intoxicated, and after 2 hours he appear on the hospital and is intoxicated. In that case, you should inform Afra because he's in the hospital and it trigger the risk to the patient. So in that case, you should inform Afra, but not in the outside, right? So please remember, because we can't interfere the private life of doctors, right? They also have their own private life, right? But he's in during the practice, it must trigger the mandatory notification. So please remember these points, okay? What do you mean, doctor? Directly to Afra. I have explained two scenarios. One at the pub, one at the hospital. If you are at the pub and you know he's having practice after 2 hours, then the only thing you can do is you can just talk with him like you should not come to hospital because you are intoxicated. That's the only thing you can do because he's outside the hospital, right? But after 2 hours, if he appear on the hospital with this intoxication, then we must report the EFRA. No, we should, doctor. This is under mandatory notification here, intoxication while practicing. So why we should bother to report for the supervisor? It's a direct mandatory notification. These are mandatory notification. Okay, please do not confuse these two. Okay, here intoxication while practicing. If you see someone with the intoxication during her practice, you must report. Okay, please remember. But you should have a reasonable belief. Okay, that's the only thing you should have before reporting. When to notify, treating the same thing if there is a harm to the patients. So, okay, I'll ask some questions from those are the exact example they have given. A practitioner report they once worked while intoxicated years ago. No harm occurred and it was isolated event. What we should do? Doctor, we are just talking about mandatory notification. Like these are the four main criteria. Here, these are the four main criteria that we should notify. Okay, please listen carefully. Yeah, here, impairment, intoxication while practicing, significant departure from accepted professional standards, sexual misconduct. You should know, like now we are discussing one by one. These are the four main criteria that trigger mandatory notification. Okay, I'll tell again the this one. Okay, a practitioner a practitioner report they once worked while intoxicated a year ago. No harm occurred. It was an isolated event. It's a 1 year ago. So what we should do? Should we notify or not? Type in the chat.
No need.
Yeah.
Not
Yeah. No need, right? Because why? Because the practitioner patient does not have issue with drug or alcohol misuse currently, and the incident occurred several years ago, no harm occurred, and it was isolated incident unlikely to occur again. There's no substantial risk for harm to the public, and you do not need to make a mandatory notification. Okay, then next one. Next example, a practitioner admits frequently recreational ice use, has attended work while still intoxicated, denies impacts on practice, and refuse treatment. So, in that case, what we should do? Yeah, we should
We
notify
have
the
to
extra.
report,
Yeah,
notify.
yeah, doctor, we have to notify, right? Okay, the famous example, we just discussed this one. Yeah, and the same thing. Okay, here what let's discuss this. While at a party over the weekend, you see a colleague with a group of people smoking marijuana. You wonder if this is also going on at work, as you have not formed a reasonable belief that your colleague is intoxicated at work. There's no need to make a mandatory notification, right? So, yeah, it is in the chat. Okay, so let's discuss about significant departure from accepted professional standard. So, what is it? A serious deviation from accepted standard that would be obvious to reasonable practitioner and place that public at risk of harm. What is it? What is in mandatory notification case we did it. Yeah, doctor, mandatory notification. You can understand the word, right? Mandatory means we should report the AFRA, not to senior. Okay, these are the four main indications that we should directly report to the AFRA. Okay, directly report to the AFRA. What is this? If we saw a doctor practicing while intoxication, if we inform supervisor first, we can reduce the harm too. No, doctor. If there is intoxication present, we must report the AFRA. That's the only thing you should do. Okay. Yeah, because usually, we it like that's what they are mentioning this as a mandatory, right? So mandatory mean we must report to AFRA, right? It's a direct report into AFRA. So don't confuse because these ethic questions, it's a very high yield for AMC, and this mandatory notification is a very high yield from these ethic topics. Okay, that's what I'm explaining this one, because you should you have to forget all the ethics of your countries. Okay, for Australia you have to follow these AFRA guidelines. Okay, because they have clearly mentioned. Okay, if you want, you can go and check this on the exact same thing. Okay, and this is my note I made today, because that note is this PDF is a huge PDF and it's very hard to read. Okay, so if there's a must thing, you have to do as they mention, right? Because we have to respect the ethics while practicing in Australia, right? So don't think other things, just follow the ethics as they mention. Okay. Significant departure from accepted professional standard. So we discuss. So these are the example. A practitioner made a medical error, employer intervened and supervision arranged, and risk is now controlled. So everything is controlled, right? There's no risk now, so there's no mandatory notification here. Okay, here your practitioner patient tell you that they once. Okay, here. Yeah, once failed to follow a protocol and made a substantial error with medicine. The practitioner patient explained that the error was because of personal stress, but it's unlikely to happen again. As the employer is now aware of the issue and practitioner employer has taken a step to address this. They already taken care of it. Although the practice maybe has briefly departed significantly from accepted standard, it does not trigger the mandatory notification because it does not put the public at substantial risk. So, example number two, your practitioner patient tells you that they have used unconventional treatment to cure skin cancer, advising their patient to abandon other conventional and accepted treatment, and you know that the treatment is unsafe and dangerous. But when you raise this, the practitioner patient shut down the discussion and changed the topic. The practitioner patient work as a sole practitioner in a private practice as you believe the practitioner patient practice is significant departure from accepted standard. So in that case, what we should do, doctors, in this scenario, what we should do?
Mandatory notification needed.
Yeah, we should notify the EFRA, right? Mandatory notification. Okay, here you know that a colleague once made an error with medicine. They took remedial step as part of a performance management plan, and their practice is now closely monitored. Although their practice may have departed significantly from the professional standard, the risk of harm to the public is rare because there are adequate control and strategies. We should not make the mandatory notification. Next example, another practitioner refer a patient to you and you disagree with their treatment plan. The plan is significantly different from what you believe is the best practice, but not necessarily from the accepted professional standard. The patient is not at risk of harm, so a patient is not at risk of harm, you do not need to notify. This is like a disagreement of the treatment, right? So you can discuss with the other doctor and you can you both can make a final decision and you can treat this patient, but this is not the deviate from the standard treatment. So what is sexual misconduct? So fourth one is sexual misconduct. Any sexual behavior connected to professional practice, including this is very like we must report there's any sexual conduct, okay? Because this is a like very high part for very high part to report after the sexual misconduct. Sexual activity with a current patient, we must report. Okay, sexual remarks or touching, grooming behavior, sexual behavior with vulnerable former patient. So, so you should know this part as well. Under national law of AFRA, must notify AFRA if you form a reasonable belief that the practitioner has engaged in sexual misconduct, is engaging in sexual misconduct, or is at risk of engaging sexual misconduct. That means if you have reasonable belief that they had past sexual misconduct or currently doing sexual misconduct, so they are like tend to do a um, sexual misconduct in the future, so you must report. Okay, the sexual misconduct is a one of main high, like very high things that you should report to the EFRA, right? So, why is past sexual misconduct is still reportable? Sexual misconduct is treated differently because there's a power of imbalance between practitioner and patient. Past behavior may indicate ongoing risk to the public, and patient safety override confidentiality concern. So, time passed does not remove the duty to notify. No, doctor, I can't share this document. This is my document for my AMC modules. You all know I'm making my own modules. So yeah, no, I can't share this. But you can use my this guideline that I have already highlighted. It's in the group. Okay. So here it's an example, a practitioner disclose a plan to engage in sexual misconduct or behavior amounting to grooming. So, mandatory notification required. Okay, here the same thing. You can read these charts from that group. The same thing. Yeah, that's all for mandatory notification. Okay, so yeah. Minute. The thing is, actually, we can't separate image question according to the ethics topics. So that we can't do. ethics topics related to these ethic topics, right? You can do 76 or something, some 76 or 73, right? I can't remember. 70 some questions in the e-medicine. So you can do those things. Then